Hello, my name is Declan Costello. I'm the editor of ENT and Audiology News. I am joined by Cesare Piazza and Giuseppe Spriano, who are respectively the heads of the two congresses being held in Italy next year, ELS and IFHNOS in June 2023. And we're here to talk about those two congresses and the exciting things that are going on in them. So I'll ask Cesare, can you just introduce yourself briefly, please?
Yes, I'm head of Department of Laryngology and Head and Neck Surgery of the University of Brescia. My main interests are head and neck cancer with special emphasis on laryngeal cancer and reconstructive surgery. I'm at the moment president of the European Laryngology Society and I will organize the meeting in Milan next June 21-23 at my MICO Center.
Perfect, thank you. Giuseppe, hello.
Yeah, good morning. My name is Giuseppe Spriano and I am full professor and chairman, Department of Otolaryngology and Neck Surgery in Humanitas University in Milan. And before coming to Milan, I was the chief of Department of Head and Neck Surgery in National Cancer Institute in Rome. So my main field of research and study and application, clinical application, is the field of head and neck oncology. And so it's indeed a great honor for me to chair the 7th World Congress of the International Federation of Head and Neck Oncological Societies that will be held in Rome in June 21st to 25th, 2023. For well-known pandemic reasons, we have had to postpone the Congress from the previous scheduled data in 2022 to have the possibility to host this important event in presence. So this was the reason for which we have postponed it in 2023.
Great, thank you very much both. It's obviously quite a busy year next year, 2023, for meetings. There's a lot going on, and I'm aware that ELS and IFHNOS are sort of slightly overlapping. Cesare, can you just explain how the two meetings are going to interact with each other and how people can maybe attend both?
Yeah, we reached an agreement in terms of splitting the topics of interest that could be of interest of both participants to the ELS and IFHNOS in order to get, for example, the laryngeal cancer and laryngeal oncology in the first day and half of the ELS meeting, let's say 21 and early morning of 22, allowing people to move from Milan to Rome, for example, by train. It needs just a few hours, and reach, for example, in the afternoon of 22, Rome, and follow, if they are interested in, again, laryngeal oncology, the last part, the last day of the IFHNOS meeting, 24 and 25, in which laryngeal cancer will be again the focus of that meeting. And obviously, in order to compensate the impossibility to be 100% present to both meetings, we arrange a 30% discount for those who are interested in participating to both meetings in Milan and Rome.
Great. So each of you are offering a 30% discount on each other's congresses if you attend both. Is that right, Giuseppe?
Yes. Yes. As mentioned, and Cesare, we have tried to transform for a negative apparent problem to a useful activity. For the logistic point of view, you have to consider that people that fly from North Europe to Italy, it's better to have the possibility to attend both the meeting instead of separate by 1 week. And so you have to go, come back home and go again. And then another aspect is that in IFHNOS Congress, we will treat all topic in head and neck oncology. So the involvement of different specialists like medical oncologists, radiation oncologists, pathologists, and so on, radiology. And then we have many other different cancer, from skin cancer to thyroid, salivary glands, and so on. And so the larynx represent a part of the Congress. So as Cesare has mentioned before, it's important not to overlapping the same day topic on the larynx. And so we will do that in order to allow the people to attend the European Laryngology Society meeting. But I think that many of these attenders are not involved only in laryngeal cancer, but can be even interested in other topics of head and neck. So it could be advantage to have the opportunity after one meeting to move to another one in order to complete all the field of head and neck oncology.
No, that sounds like an extremely sensible way of doing it, and it's great that the two societies have worked things out so carefully together in terms of covering the laryngeal topics so that people can go to both. Cesare, just tell us a little bit about a few of the highlights from your point of view of the topics that are going to be covered at ELS.
Yes, the ELS obviously covers not only the laryngeal oncology, but also a wide array that comes from neurolaryngology and recent advances in this field, to treatment of neglected disease like spasmodic dysphonia or swallowing problems, coming to airway stenosis and difficult case management in children, in traumas, and obviously in tumors infiltrating the airway. So obviously there will be space for other recent advances, for example, laryngotracheal transplantation, use of stem cells, and other fields of, and application of basic science in the area of laryngeal disease. And also space will be devoted to phoniatrician, phonosurgeons, and speech and swallow therapists that are involved in a multidisciplinary way in management of voice, swallowing, and airway disorders, apart from laryngeal cancer, clearly.
Yeah. Fantastic. No, that's obviously covering the whole range of laryngological issues. That's great. And Giuseppe, from your point of view, with the IFHNOS Congress, what are the key topics that are going to be covered?
Yeah, you know that we will have many keynote lecture, roundtable, symposia, debate. Especially, we have involved many societies that are affiliated to the IFHNOS. Today, we have 68 societies in the world, Head and Neck Oncological Society, that will have the possibility to have an own symposium during the Congress. This is important because the idea is to have a whole world Congress. So all the people involved in head and neck must to have the possibility to learn and to teach something. And you know that the evolution in the field of head and neck oncology is very fast. We have now the immunotherapy in medical oncology that has overlapped the typical systemic therapy, and then innovation in radiation, especially in radiotherapy, innovation in surgery with robotic surgery, endoscopic surgery, and so on, but even innovation in research, especially in translational research. That means to go to a personalized therapy for each patient, even if the tumor seems to be the same for stage and for site of origin. We know that some tumors go well and some other not, and so there is some that we need to understand in order to try to know why there is a difference in outcome. And I think that another important aspect in Milan as well as in Rome, that in summer the weather in Italy is fine, and so all the attenders would have the opportunity even to spend some time for vacation before or after these two meetings. And Rome and Milan are a very outstanding city even for vacation and tourism.
Absolutely. No, it's a lovely opportunity to have a little tour of Italy and build in some meetings at the same time. No, it sounds fantastic. So just a reminder that ELS is 21st to the 23rd of June in Milan. IFHNOS is 21st to the 25th of June in Rome. We'll wrap up in just a second. Is there anything else either of you would like to add? I'm very grateful to you for chatting. Anything else you'd like to say before we sign off?
Well, for example, in Milan, there will be also some symposia, industrial symposia, that will be devoted to the show and try of some new surgical device ranging from, for example, exoscopic surgery to new bioendoscopic tools that can obviously be seen and tried in the coffee break or during special lunch symposium, for example.
Fantastic. And Giuseppe, anything else you would like to say just before we finish off?
Yeah, of course, all the people are welcome in this meeting. You know that for the last 3 years, we have had only Congress by internet or webinar, and so it's a little bit different comparing to the opportunity to live together and to discuss even out of the scientific section. So it's a great opportunity to meet all the friends that we have not the possibility to see in the last 2-3 years.
Absolutely. I think everybody's very much looking forward to in-person meetings again. And thank you both very much indeed, Cesare and Giuseppe. It's lovely to talk to you, and we will see you in Milan and Rome in June 2023. Thank you both very much.
Okay, thank you.
Bye-bye.
Bye-bye.
Bye.